Welcome back to the Primal Reset podcast. Today, we're joined by Dr. Nishant Patel, the founder of SafeHavenMD and director of urology at United Medical Doctors. He's not only a leading urologist, but also a powerful voice in the physician mental health, creating a confidential support platform for doctors facing burnout and addiction. Dr. Patel, it's a pleasure to have you. Welcome to the show.
Thanks so much for having me, Elliot. Really appreciate it.
Absolutely. Share with me your story. What got you into going from being a doctor at United Medical Doctors and going into entrepreneurship and starting on the mental health side of things?
Right. So my story starts, at a young age. I've always wanted to be a physician. I grew up in a small town. We were really the only Indian family there, so there was always a sense of kind of feeling out of place. But, when I had immigrant parents, from Southern Asia, there's a lot of pressure and drive to succeed. And I was always going to be a doctor. That was just assumed. So that's a lot of pressure for, young kids. And I internalized a lot of that pressure, I would say, where I drove myself to do it. And I was a pretty good kid, did all my schoolwork. But then when you talk with people recovering from, alcohol's my substance of choice, recovering from alcohol, they usually can describe the first moment they drank, in detail and what they felt and how it was, the answer to all the problems or quieted down the brain or finally made me feel part of this society and this world. And that's exactly the feeling that I had. I remember every bit of it. And so I just wanted more of it. And so that started really with my first drink. And I was able to drink a lot, but also succeed in school. So I used one to justify the other in a sense. So I, proceeded through undergrad, medical school, but then the drinking became daily in medical school. I recall periods of, we would start the day at like 5 a.m., but I'd be emptying out like water bottles, filling with vodka, putting in my white coat. Like this is fine. Nobody's gonna know. It was just normal for me. I didn't think anything was wrong with it. And then some, issues came up like arrests and disorderly conducts. And, I wish somebody had taken me to the side and said, hey, what is going on here? Are you okay? Do you need help? Right. And there was really nothing out there. It was either kind of brushed under the rug or I was called into the dean's office one day and because the police report appeared in the newspaper, very embarrassing. I said, "What is all this?" It's like, you either shape up or you're out of here, right? Like there was no middle ground of saying, "Is this person okay? What kind of help can we offer this person?" And when I, think about what I'm doing now, I always think back to the time, what would have helped me at an early stage, right? So the drinking continued. I finally did get sober starting in 2009 after a pretty bad DUI, almost being kicked out of the program. And, there's a moment of just kind of surrender, really, where I said, I can't do this. I think, I'm going to die. I'm going to die from drinking because every time I would, I'd need to go to the hospital to detox. I'd have severe withdrawals, DTs, things you read about in the medical literature. And, I was experiencing all those symptoms, and I got sober through 12-step programs, had to be monitored by the, medical boards, had to pee in a cup every week, lots of meetings. And it was a good period because it was the first time I had been sober as an adult during residency. And, I started to finally like myself, feel part of some group. When you're working so hard as a resident, everyone's going through it. And it was a good time for me. A lot of doctors will say residency was, the hardest and toughest. It was that, but it was some of the most stable periods for me. And then, life happens even in sobriety. And I had some issues when I went out to the East Coast to work at an academic center for a bit where, I got married. All the good things that you happen in life happened because I was sober. Got married, had kids, found a job, house, the whole deal, right? And that almost wasn't the case, at one point. And my kids both had medical issues. One was born severely premature. The other had a congenital issue requiring lots of surgeries. And I was working as a full-time, surgeon, husband, trying to do it all. And depression started kicking in for me. And, I didn't even know it. It's kind of like when I didn't know that I was really an alcoholic. It was just normal, losing weight, not sleeping, forgetting things, irritable. And, I just kind of crashed at one point. I couldn't do it and asked for some time off. And I was supported quite a bit in my recovery from alcohol during my residency. People understood it, but the depression, that was, and on the East Coast, they do things a little bit differently. It was penalized in a way, where they took me out of work. They said I had to go to this center. I was under investigation for issues related to my irritability, and it was all just very strange. I couldn't talk to anybody at the hospital. I had to go through either a lawyer, and I was eventually let go from that position. And then my depression worsened to the point where suicidality came into play. And that's, it's if you've never felt it, it's a scary place to be because it starts off very slow, I think. People don't decide to just do it. It happens, I think, with kind of a downfall. And it starts slow, and then it starts like a whisper, and then it starts talking, and then it starts screaming. That's what it felt like. And then every day becomes torture. And you just want relief, right? And suicide seems like the correct answer. And like I said, people that have been there can empathize. People that haven't been there, I think they can kind of grasp what it's like. But, there's a kind of comparison where inside the fire sounds better than outside of it, meaning, you know, I've gotten very close to the flames, right? And I just wanted the pain to end, not even knowing what was on the other side, if there was even anything, which is super scary. But I got help. Again, I had like a moment of surrender and said, I can't do this. And that leads me to, I wanted to maybe leave medicine because of some of the way I was treated. I just said, this is not for me. So I got into business school out here in San Diego, not knowing exactly what I wanted to do. I knew I wanted to help people because I had a lot of experience, over 17 years in the medical field, dealing with substance, depression, burnout, all of that. And I found a way through. It's not pretty at all, but there's a path forward. So I actually got a job as a urologist. I told the company that I currently work for kind of the deal and said, well, we just want to support you, right? And it's amazing what those words can mean to people, to physicians especially, or anybody, when your leadership supports your issues, your mental health, your physical issues, can make accommodations, right? That makes me a better surgeon, for sure. But halfway through business school, we had a healthcare class and had to come up with a new idea for a business. And so I thought of this, SafeHavenMD, where it's a confidential platform to help other physicians because I think physicians are a bit leery of going to their own hospital with these issues for obvious reasons where you can be punished or they will report you and then people don't get help. And then we hear about really the extremes, physician suicide, physicians, caught diverting drugs at work or, found comatose at work, DUI after work or something. We hear about the end results a lot of the time. And I thought if there was just a way to intervene a little bit earlier, perhaps we could avoid these disastrous consequences for physicians.
Absolutely. Yeah, I mean there's definitely a lot to unpack, and
Yeah.
I always say, it's kind of like the physician always asks how you are, but no one ever asks how the physician's doing. And we need to create more of that awareness. Like, they're people as well. They go through ups and downs just like everyone else. So when we talk about mental health in today's society, that includes everyone. And I mean, for particular professions, it's going to be essentially more work than other professions could be. And that's not to generalize everything. Sometimes people go through personal stuff on the side that can be a lot, and sometimes professionally it can be a lot. On a professional standpoint, obviously doctors with residency and med school and, sometimes starting at, birth, where that pressure is kind of being put on and not even realizing that trauma sticks with you. There's definitely a lot of implications that could affect the professional life as well as the personal life. I mean, like I said, there's so much to unpack on this kind of topic, and especially for the physician side. What do you believe with the current healthcare system that's failing physicians when it comes to mental health support?
So I think, there's been some research on this, and through, very large surveys of, up to 10,000 physicians, 50% report some kind of burnout, 20% meet the criteria for depression. I think a lot of the burnout has come from administrative burden, seeing more patients in less time, doing more work outside of clinic hours where we're calling patients, writing our notes, dealing with insurance companies, and that's all uncompensated work, right? And so, we'd feel a little bit better maybe if we were kind of compensated for all the unseen work, but I think part of the answer is somehow reducing this very high administrative burden. It's changed for physicians. And there are people working on some solutions, right? With the age of AI, there's ways to really cut down a lot of time on these tasks, which is great. I think we can utilize technology to its fullest extent. However, when people reach that point, there's also the personal side of things. If you're more prone to depression or more prone to substances, or like I was, I think I was pre-programmed for all this stuff. I just, came out like that. And there's the fear and the stigma, right? Especially when these stories come out. And even sharing my story, I didn't do it for a while, and I do it in the hopes that it can potentially help just maybe one person. I don't know. That they can say, hey, I've experienced some of these things, but in sharing my story, I've experienced the other side as well, right? In the judgment and the stigma. And so that fear is real. That fear is absolutely real to get help. And I think a lot of physicians feel trapped in terms of, whatever position they're in. Will I find another job? If they find out I have this mental health issue or I even had burnout, will anyone want to hire me again? And they're all valid fears, I think.
Absolutely. I mean, and like you mentioned before, that way of not having help, especially even accepting that you do need help as a physician, you can't go to your own hospital. There might be some hospitals that will work better with
Yeah,
you than others, but that's fear that kind of fuels that physician of like, I have to be nothing but perfect within my role and within my appearance and everything that I do, because my job's on the line, my job's in jeopardy. And that's where, like you mentioned, burnout ends up happening. And whether it's professionally and personally, or even just, the care that they have for their patients, could drastically change, whether for the positive or the negative is not something that I'm an expert on, but it's something that's scary, and that I think I agree with you, and it definitely needs to be more awareness out there and more help out there for those physicians that are going through things, to
yeah,
be able to have them perform better in their job and personal life as well.
and just creating this platform, growing my network either through the business school or different conferences, you know, there's people out there that are doing this work as well. And speaking with a lot of them, there's still the problem of how do we intervene early? Because one other physician said to me, when physicians get help, and this is often for any, even when I'm in recovery with a bunch of my, guys that I do recovery with, the ship's like 95% sunk before the SOS goes out, right? You have to be up against tremendous consequences or already have experienced these consequences and then saying, I give up. And you can come back from stuff like that, right? And sometimes you can't. But if somehow we could figure out a way to intervene just a little bit earlier, right? Because I had just tons of painful, traumatic experiences. And if I can help avoid those for somebody else, right? That's the whole idea, is using that experience to intervene a little bit earlier.
Absolutely. And to that point, how do you envision the integration of mental health support in medical training over the next 5, 10 years?
I think, we're seeing a lot of mental health issues pop up in medical students, even undergraduate students. I think there's more awareness, but the competition is very high as well. That hasn't gone anywhere, and the pressure, wherever it comes from the self, from society, from the family unit, I think we're going to start seeing it integrated earlier and earlier, right? Like, let's not wait till you're fully on your own physician and then say, hey, what about your mental health? I think as we incorporate it earlier and earlier into these, medical school curriculum, and some have, and they have support services for medical students. I used to give a talk as a resident to the medical students about a longer version of the story I just told you. This was back in like 2011. I was doing this, and it was even worse. Nobody was talking about this, right? It was kind of shocking for folks to hear, wait, you were drinking at work? I was like, 100%. And well, I'm glad that a lot of people, their stories aren't going to be as severe as mine, because if they were, we'd be in a bigger mess. That people are at different levels, and we have to meet them there. And I think it's imperative that we start talking about these things earlier and earlier in training, so people are prepared. They know where to reach out. They can have some self-awareness of whatever is going on inside them. So that's what I envision for folks.
Yeah, and hopefully we move towards that direction as well, where there's help not just from, Safe Haven MD
Oh,
or
sure, yeah.
like-minded, but also within the medical students and the whether they're physicians or they're just students, also with them. Sometimes you're not going to be able to help someone that doesn't want it. So
No, I
hopefully
I
there's that
didn't.
awareness.
I fought help, I was
Yeah.
I was forced into certain rehab centers, and it wasn't until, my pain was bad enough and I wanted to change that I actually got the help and did the change. And for some folks, for many folks, it has to come down to that. It just does. And it's sad, the calls we get, and people are, at some of the lowest points in their lives, right? And the worst thing to do them is kick them while they're down. And that's what a lot of the, formal institution processes do. These people are suffering, and then they just pile some more on top of that. That's not the way we help people.
Yeah. No, I definitely see that. My next question, how can vulnerability among physicians lead to a stronger and more resilient healthcare system?
Hmm. That's a real tough one because, just being from the surgeon culture, you just deal with whatever's thrown at you, build your skin as thick as possible. Do not show anyone what you're feeling, because that's the image you need to put out, right? And I thought that was the case, and I'm 10 years out of training. And one of the first things I do when I talk to a patient, I just, I see what's going on in their life, or if I can sense something else is going on, I try to let them share what that is. And then if I have something that I can relate to, I share about what I'm going through, right? Oh, my kids, need surgery. I was go, oh yeah, my kid needed surgery too. And the connection we can develop with somebody for, having that vulnerability is sometimes stronger than the medical service I can provide for them, right? That helps them sometimes more than any medication I prescribe them. And so it's incredibly important that we can do that with our patients, but can physicians do that with each other? Because often we're so busy in our silos doing seeing all the patients, notes, and all this sort of stuff, but I make it a point to the physicians around me. I was like, it can be easy as, hey, did you eat lunch today? Right? They're like, no. I was like, let's go do that. I can tell if something's up. And it's like the checking in on each other aspect. In my recovery group, that's what I do all day. I'll just, find someone that comes to my group. It's like, hey, what is going on? Lay it on me. Like
Absolutely.
I'm like a safe person to do that for. And if we looked out for each other, or the physicians, as much as we looked out for our patients, that would be ideal, I think.
Absolutely. Even just the small things starting off, how are you doing, like you mentioned, can go a long way.
Yeah.
Um, I can't remember. I remember a quote from someone. No, it was Simon Sinek. So he mentioned a friend was going through something and reached out to him. And, Simon, being the good guy he is and good friend he is, sat down with him and he goes, honestly, like, I'm not sure how to help. I'm not sure what advice I can give you. I'm not sure what to do. So the best thing that I can do, and sometimes this is what people need, is I'm going to tell you, the person who asked for help or needs help, about me. And I'm going to tell you what I'm going through. And in that realization of this is what they're going through, this is what they're doing or they want to do, it almost helps fix their own problems or own challenges that they're going through in their own mind as well. So I love the point that you mentioned. You're like, I'm an open book. I'm here to help other people. I'm going to connect with them one way or another. If they have kids that went through certain surgery, or if they have complications in their life of somehow that you've gone something through similar, sharing that, like, hey, you're not alone. I'm with you right there. I'm able, maybe not exactly the right same thing, but in the same aspect, if you can be there even just a little bit, that's where it keeps them, I'm not alone in this life, and helps at least at the start. It kind of
Right.
leads up to my next question. What's the very first step? We always look at the end results. We need to focus a bit more on the process and the journey to get to that end result. What's the first step that a physician can take and helping them achieve a better mental health?
I think realizing you don't have to do it alone. That is what we're taught. It's like I have a physicians, great brains, right? Like they can handle many tasks. There are some problems that the brain has created them, that brain can't fix those same problems. If I just do harder work, I'll fix that problem. If I, just keep it inside, nobody has to know, so I'm not out there, that'll somehow fix the problem if I don't share it, actually. The first step is that connection, you know? You need a hand sometimes. And that's the first step, is realizing A, there is help out there, and B, whatever you're going through, I guarantee you there's someone out there going through something very similar. And that's what people want. They want to know. They want to know they're not alone. And I've felt alone many, many times in my life, right? And hearing some of, like, this is where it gets very personal. When I hear about physician stories and they get even that little bit of success, like they get into treatment, right? That helps me. That helps me on the path to, you know, staying sober, keeping my mental health. They're helping me more than they know, right? These people are totally struggling, but I don't think they understand the reciprocal effect of it. That what you're going through is actually helping me more than you know.
Yeah.
And that's the special part of a lot of this.
Yeah. Well, I appreciate your story and you being able to open up and share that with everyone as well. And if anyone is looking for who is a physician or a med student,
Resident.
resident, if you're in the medical system, in the medical healthcare system, reach out to Nishant. Go on SafeHavenMD.com. Go look at his services. Reach out to him. I believe you have an app.
I do.
Download his app. Reach out to him. Talk with Nishant. It'll help him. It'll also help you as well. I'll have all the links below in the description. But Nishant, it was a pleasure having you on the show today. We'll have to do this again in the future. There's definitely a lot more to unpack.
Definitely, Elliot. Thanks so much for having me. Really appreciate it.